Okay, good afternoon, everybody. I'm going to call the meeting to order. I, Rudy Lopez, the president of the governing board, call this special board meeting of the San Ysidro School District to order at 5:01 p.m. I would like to ask that all members of the board mute their devices at this time. The trustees of San Ysidro School District and the public shall participate in this meeting via teleconference. The public may view the open session part of this meeting by accessing the YouTube link provided on the agenda. To listen to this meeting in Spanish, please call area code 347-378-8840 and enter the access code 793-318-029#. Para escuchar esta junta en español, por favor llame al área 347-378-8840 e ingrese el código 793-318-029 y signo de gato. Members of the public are welcome to record this meeting using their own personal devices. Prior to roll call, I would like to make clear for the record of this meeting, and it should be reflected in the minutes, that this governing board meeting is conducted pursuant to AB 361 and resolution number 21-22-0021. I will now ask the superintendent and secretary to the board, Dr. Potter, to conduct a roll call for attendance.
Thank you, Mr. President. Good evening, everyone. Conducting roll call agenda item number 2, beginning with board member Antonio Martinez.
Present.
Board member Humberto Grimilán.
Here.
Board clerk, Mrs. Irene Lopez.
Present.
Board vice president, Mrs. Rosalia Palasigue.
Present.
And board president, Mr. Rudy Lopez.
Here.
Mr. President, all 5 board members are here.
Thank you. I would now like to request that each board member respond to the following questions. Board member Martinez, can you hear me well?
Yes, I can.
Were you able to hear our proceedings on this end until now?
Yes.
And do you have a copy of the agenda for this meeting?
Yes.
Thank you. Mr. Humberto Gurmilan, can you hear me well?
Yes,
Were you able to hear our proceedings on this end until now?
I could.
Do you have a copy of the agenda for this meeting?
I do. Thank you.
Thank you. Our board clerk, Ms. Irene Lopez, can you hear me well?
Yes, I can.
Were you able to hear our proceedings on this end until now?
Yes.
And do you have a copy of the agenda for this meeting?
Yes, I do.
Thank you.
Thank you.
Board Vice President Rosalia Palasigue, can you hear me well?
Yes, I can.
Were you able to hear our proceedings on this end until now?
Yes,
And do you have a copy of the agenda for this meeting?
yes.
Thank you. Moving on to agenda item number 3, I'd like for you all to join me in the flag salute. We'll be displaying a picture of the flag on the screen. I would ask those in the meeting, including other board members, to please mute their device to avoid feedback. Right hand over your heart, ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you. Moving on to agenda item number 4, I will now ask each board member if they have any corrections or additions to the agenda. For this item and all other items on the agenda, I will give each board member an opportunity to speak by addressing each board member in turn. Please make sure to unmute your device before speaking. Board member Antonio Martinez, do you have any corrections to the agenda?
None.
Thank you. Board member Humberto Gurmilan?
No.
Thank you. Board clerk Irene Lopez?
No.
Board vice president Rosalia Palasigue?
No.
Thank you. I also do not have changes to the agenda, so I will now ask for a motion to approve the agenda.
So moved.
Mr. Martinez moves,
And Mrs. Seconded.
and Ms. Irene Lopez seconds. All the votes during this meeting will be completed by a roll call, so I'll now ask Dr. Potter to conduct a roll call vote.
Thank you, Mr. President. Calling for the roll call vote for agenda item 4 to approve the agenda, beginning with board member Antonio Martinez.
Yes.
Board member Humberto Grimilán.
Aye.
Board clerk Irene Lopez.
Yes.
Board Vice President Rosalia Palisige,
Yes.
and Board President Rudy Lopez.
Aye.
Mr. President, the vote passes 5-0.
Thank you very much. Moving on to agenda item number 5 is public comment. I will ask Coordinator of Public Relations and Community Services, Mr. Francisco Mata, if there are any public comments at this time.
Good evening, everybody. Mr. President, there are no public comments for this session.
Thank you very much. Moving on to item number 6 is our conference session. 6.1 is our COVID surge staffing shortage mitigation plan presentation. I will now ask Dr. Potter and Cabinet to present the COVID surge staffing shortage mitigation plan. After the presentation, I will ask each board member for any comments or questions they may have. Dr. Potter?
Thank you so much, Mr. President and members of the governing board for this special meeting of the board. This particular presentation provides the governing board with an update of what's happening with the current Omicron surge throughout the state of California and the impact that it's having also in our county and within our school district and schools. I'm happy to share the stage this evening with 2 cabinet members. Our Assistant Superintendent, Dr. David Farkas, will be joining me on a few slides, as well as our Interim Executive Director of Human Resources, Glenn Heath. Next slide. So the Omicron surge was a variant or Omicron that the World Health Organization determined to be a concern worldwide as of November 24th of this last November, 2021. Also in November on the 26th, the World Health Organization named the B11529 variant as Omicron, and they classified it as a variant of concern or a VOC. By November 30th, United States designated Omicron also as a variant of concern. And by December 1st, the United States saw the first case of Omicron that was identified. The same date, November 1st, California also had the first identified case of Omicron. As of January 8th, this January of 2022, the CDC is reporting that 98% of the positive COVID cases in the United States are now identified as Omicron cases. What does that look like in San Diego? Well, in December 10th, San Diego identified our first regional case of Omicron. And by January 14th of this year, 2022, of the 54,000 COVID cases that were tested in that 7-day window of time that came back positive, 28% of them also came back positive of that 54,000 number. And so what we're seeing is what we call the surge or rapid rate of positive COVID cases in San Diego County and across the state, and quite frankly, across the nation. From December 12th to the 18th of 2021, all of the positive COVID cases in San Diego County, 45.8% of the positive cases were individuals not fully vaccinated, and 18.1% are cases that were fully vaccinated. Next slide. So this particular presentation will give an overview or summary to the governing board on how the Omicron surge is impacting our school district. We'll first cover the staffing shortages, then we'll cover student absence rates, the COVID school safety guidelines that we're implementing, and also a staffing shortage mitigation plan. Next slide. I'm going to turn the mic over to our Interim Executive Director of Human Resources, Glenn Heath. Mr. Heath?
Good evening, Board. This will give you a little perspective of how Human Resources has been impacted with staffing. We've had 6 days counting today, and that slide is not up there, but I'll give you that information. If you look at the average absence rate there on the right from July to December in 2021, you'll see that on an average, we had about not quite, just under 12% staff absences, 66 or so out of 531 or 561, and that's an average absence rate. And if you go back up to the Tuesday, January 11th, you'll see that that's when staff returned and the kids returned. And you'll see on that day that we had 115 staff of our 561 who were absent for about a 20% absence rate. And that kind of came to a head last Friday. You'll see that each day it went up. And then Friday, it was over 26% of our staff. A quarter of our staff was absent on that day. So we in HR have been doing everything we can to make sure that we're covering classrooms and making sure that kids are safe. Today, you'll see that yesterday it went down, and today we were at 102 of our employees out of 561 for an 18% absence rate, which obviously is better than we've had. And so it's going down, and we're encouraged by that statistic. But the percentage that we feel of those employees who are absent each day, it's somewhat hard to calculate specifically, but we feel that about 30 to 50% of those absences are in one way or another related, COVID related. So I hope that gives you a little bit of a perspective on what we're dealing with as far as staffing shortages.
So Mr. Heath, real quick, you said 50% are COVID related?
Well, we feel that it's between 30 and 50. It could be as high as 50%. And just remember that that's not all staff don't have it themselves. It could be related to family members at home, or they've been, a close contact or something along those lines. So, but we feel that, somewhere between 30 and 50% of all of our absences are related in some way or another to the COVID surge.
Okay.
Thank you very much, Mr. Heath. When you look at these statistics on that former slide 4, the summary in general is that our district, along with most of the other districts in the state of California, we're all currently in the middle of a staffing shortage crisis. We do believe that it's prompted by the COVID Omicron surge. And we're doing our very best to bring to the governing board our staffing shortage mitigation plan this evening, so that you know what we're dealing with across all of the schools. We are indeed prioritizing staff support to the schools wherever we have staff available to make sure that we can safely keep our classrooms open for our students. Next slide. I'm going to ask our Assistant Superintendent, Dr. David Farkas, to share both this slide and the next one. Dr. Farkas.
Good evening, everyone. It's a pleasure to be with you sharing this data and these actions. This slide is based on our student absence rate. As you can see, coming out of our winter break, our 3-week break, which actually we believe benefited us a little bit to get prepared to reopen. Week 1, we did have much higher absenteeism than we would in a normal school year. It was a 21.47% for that week. And then our current week, we are at 20.76%. And again, just to piggyback off of what Mr. Heath was saying, this is A certain percentage of this percentage is based on obviously everything going on with our schools when it comes to Omicron. Positive cases, number one, and then also those close contacts and brothers and sisters that are staying home for that short, hopefully now, and that'll be the next slide, the short time that they have to stay home to quarantine or isolate.
Dr. Potter, can I ask something? Mr. Farkas, Dr. Farkas, these absences, if they're with COVID or just absences, whatever, is it the information you get because they report they're positive? Is it on ASOP that you get that actual percentage from?
So this one would be our synergy for our student accounting, our attendance accounting. But this is, again, one of those calculations based on teamwork. It's based on our parents calling in, being very clear and specific with our school staffs, our outreach consultants following up with our parents for independent study contracts, and ensuring that we get that new information that'll be coming on the next slide out to the families on when they can return. So I don't think there's been a presentation I've been involved with for the last year where I haven't used the number one word is proud. All the hard work going on behind this to just get communication out accurately, consistently, and to work together at our school sites when everything keeps changing almost every week. So these percentages aren't great, especially if it was a traditional school year. But again, it's a real tribute to the hard work going on at our schools and the parents calling in and being very specific, because we do have codes then that go into the attendance that says why someone is absent, and oftentimes it's because they're positive with COVID or a family member is positive with COVID.
Our students though our students, do we have how many students are on are independent is a study? Or do we have an amount of?
So that short-term independent study depends on when a student has to be out. It's usually about a week, but it could be up to 2 weeks. And those, again, those wonderful personnel staff that we have at our in our employee ranks throughout our district, and especially at our schools, they do a great job of getting those contracts ready. Teachers do a great job of getting work together so that that student doesn't miss at least some portion of that instruction, so they can keep them attached to the classroom. And then also it recovers the attendance once they submit it and get it graded from kindergarten all the way up to 8th grade.
Okay.
Good question, Ms. Lopez, good question.
Dr. Farkas, perhaps in a board update, we can indicate the total number of independent study contracts, students that we have currently on independent study contracts.
We sure can, and that changes every single day, so absolutely.
Thank you.
It's a good idea.
And just so that we're clear with these student absence rates, only a portion of these percentages are COVID related. So I would say, reasonably speaking, based on the data that we currently have, I would say on the data we currently have, 5% or less are COVID related absences.
I think Dr. Potter's pretty close with that percentage, just to kind of ballpark it with everything that's going on any given day. We are definitely working on probably about a 5% at least positivity rate when it comes to students. And then there's also that attachment, like I said, where students are just staying home because of a different case in their home or isolating. So it could be, so that's
they're not all COVID positives, but
correct.
They may be a close contact or a household contact.
Yep.
All right, next slide.
So that last slide was kind of not exactly a celebration slide, but this one I would consider just a tremendous opportunity to not only educate everyone on all the hard work that's going on and all the mitigation strategies we've been using since the pandemic began and how we've evolved, and also again to celebrate all the work that's being done. opening with the COVID testing, we created a reopening idea where we would test anyone that wanted to be tested before we came back to school on that Tuesday after break. So we started with the Monday before break, and that's when staff, employees came to work and they had the opportunity to test at our workplaces, mainly Ocean View and Sims outside with our incredible testing team of our own people, came together and did a hard work job all day together. We had pizza safely and just really, we tested over 1,000 people that day. So it was amazing. And that was anyone that could test, whether it was a student or an employee, we got them through those lines, and that helped just kind of reduce, I would say, significantly opening school, knowing that we detected some positives right away. And that was great if, for the situation, of course. And then we also had, for quite a while now, we've had the weekly concentric pooled testing at our schools. And that pooled just means there's a group of Q-tips that go into the test tube, and then it's PCR'd at a lab and turned around real quick with the results so we can follow up if there's any positives. And that's been going on before Omicron, and it's really helped serve us to find positives in our weekly testing plan. We also have Wednesday and Friday currently for staff testing at the district office, and that's for any employee in our district. We open up a window that's pretty large for lunchtime between 11 and 1, so anybody that wants to can scoot over to the district office and we can get them in and out in about 15 minutes. So that's the fastest line probably around. And then as needed, the COVID testing, we have different now we have the capability, just because of the hard work of our employees, we have different spots during the school day at different locations where we could always test some employee as needed. And then also when we have those close contact situations, because someone was in a classroom, we can test that class the following day to make sure that they're all negative. And that's our little test teams that run around 100 miles an hour, and we're really proud of them. And then recently, yesterday, we gave every employee one home test. And this is in addition to what we did with our students before they came back. So all the employees have that in case they need it. It's not something that they're being directed to take for no reason. It's more for just safekeeping when they do feel maybe a symptom and they just want to double check so that they don't have to go out of their home to check. So a real useful tool. And I want to thank Mr. Ysidro for getting the crew up to the San Diego County office, the warehouse, and also the state that backed this, our whole California initiative to get tests to our schools and to our homes. And then face masks, that is an upgrade. As you know, we've had face coverings, and again, it's been a challenge, but as far as our community, it's been embraced. It's truly reduced the transmission rates, and we've even upped it to where we have Ns and KNs, especially the KNs, for all of our employees weekly. And then our students have the surgical masks, which are the best available for students, and even the little ones for the smaller students. And that's something that we replace often, like I said, weekly for staff, and then students anytime they need a new one, especially weekly. But if one falls on the floor, we're quick to get them another one. So we're encouraging the higher quality masks in our classrooms. Not mandatory, but encouraged. And again, with this district and the people that surround our district that come to work every day, they're just doing what they need to do to make sure everybody's safe and take care of each other. It's just tremendous. And then new isolation and quarantine period. This decision tree, sometimes we get frustrated or we even laugh because it changes so often, but it is based on science and it is directed from our county informed physicians and epidemiologists. So in the end, as much as it changes and we have to keep educating each other and running through scenarios and praising the people at the school sites for changing with the times, we're just really thankful that now we have a 5-day isolation period if you're positive, employee or student. But then again, on day 5 that evening, you have to make sure you have a proof of a negative antigen test, which is the rapid tests, which is the ones we've sent home on the home kits, and which is all the testing we do pretty much at our district that are the 15-minute turnaround time. And those can bring an employee or a student back on day 6 if they test negative the evening of day 5 from their onset of COVID. If it doesn't happen that day, then we give another test. We have the opportunity to give them another test, and hopefully they can come back the following day. And that could go all the way up to 10 days, depending on the individual. But everyone gets to come back regardless after day 10, as long as they are free of fever and their symptoms are improving. And then this one here, the second bullet for the new isolation quarantine period, this is always the trickiest one. And it takes a couple breaths and just kind of working through it, especially with our health offices and all our incredible leaders at our sites. It's based on if you have a contact that's not in a classroom, it's more of a brother, sister, or mom, dad contact. And that has changed. And it's also based on vaccination. Vaccination's a big component, obviously, in this whole pandemic, and also inside the decision tree on how we proceed to bring students and staff back. And then the updated decision tree, I mentioned that. There's been a few updates, including an electronic tree that makes it a lot easier with the drop down menus, and that assists people in making the right informed decision. And we want to thank the county for organizing that electronic tree. It makes it a lot easier to navigate. So that's it. Again, just some of the many things we've evolved and come a long way. And I'm just really, again, proud and thankful for the opportunity to work with such an incredible team. We wouldn't have made it this far without everybody.
Dr. Farkas, just real quick, there's now a federal government website called covidtests.gov.
Yes.
That's live. And basically what happens is that every household home is eligible for free at-home COVID-19 tests.
Yes,
and
thank you.
it's actually pretty simple, and you can order. It takes around 7 to 12 days to arrive, but that's something that could be an additional service that we can offer our families. Don't know if you want to put that on our social media and whatnot, but that's something that's new, and I just found out it's live.
Yep.
It was live yesterday, so.
Yep, I'm working with Dr. Potter and Mr. Mata to get that out to our community, our stakeholders, and also, again, goes back to taking care of each other. I've had a few friends in the district already do exactly what you did. Remind me, hey, this is something new, let's get it out. So again, it takes everybody's ears and eyes to get this done right. So thank you, Mr. Martinez.
Yes, I ordered mine yesterday. It took about 10 seconds. So they made it very, very easy for people,
Very
which
good.
I appreciate.
Yeah, that's an additional 4. We'll take that because you never know when symptoms are going to show up and you're questioning if it's a cold, flu, or COVID. And the only way to find out is with those tests, and they're fast. PCR tests are very accurate, but these antigen tests are almost as accurate, and they prove to be reliable because they also get people back to work and school, and you don't have to wait 5 days to get your results.
Dr. Farkas and Dr. Potter, how many tests do we have at the district? How long is this sustainable, and will we just keep replenishing the supply, and where is that supply coming from, and are we purchasing those?
Well,
And what part of the budget is that coming from? Just
Okay.
curious.
Those are good questions. Yeah. And those are part of our I'll start backwards. We use our ESSER funds for safety, and we've worked on those funding for all the different reasons, mostly masks, PPE, anything to do with disinfecting and sanitizing our schools and rooms. And then also now, Marilyn and Dr. Potter did a fantastic job of getting ahead of it, and they ordered us plenty more of our self-tests. So this is going to be an incredible tool to use for many reasons in our district, including helping our students that might have to go home, and then when do they come back, or if they've had symptoms or a close contact. It really just keeps students in the classroom instead of pulling them out. They can take the kit home and then come back safely the next day with the negative. That's just one of many. I can do a whole nother presentation on why the self-kits are wonderful. So that has been an order that's going to replenish our inventory. The initial inventory came from the county through the state, and Mr. Ysidro was the first truck to pull up. He got the crew and they got up there right away. So we received almost our full allotment of tests, and that's what spawned the idea to test as many people as we can before we come back from winter break on that Monday, along with our test tables that we set up at our schools. So we're staying ahead of all of our inventory needs. If I see something start getting a little depleted, I start running around panicking, and then we get an order in. But most of the time we stay pretty far ahead of it, especially with these new self-tests. I think I've been I'm probably being a little obnoxious and irritating with some people around here, but they gave me what I needed. Maryland was so fast in ordering our backfill, so we're in great spot. That's why we were able to get everybody in the district a test kit. So that's exciting too. I'm sure I missed a few questions that if I missed them, let me know.
No, that's fine. And Marilyn, how much is left in ESSER fund and these ESSER funds for the use of these ordering of kits and stuff? I mean, how long is this model, or how long is this model sustainable for the ordering of test kits and administering of tests for the community?
I would have to run the actual budget to tell you the exact amount, but we did set aside roughly $700,000 for PPE. So we haven't met the target yet.
Okay.
Yeah.
And maybe at some point we can review how much of that is depleted.
Okay.
It's just something, I know you all are watching it, but you know, that would be good for us to take a look at with board members. Thank you.
You're welcome.
I probably would miss something, but I know that probably off the top of my head, our top three are now the self kits, obviously the masks for our kiddos and our employees, the good masks, keeping us an inventory of both of those. And then what Mr. Acevedo's crew does when we're all sleeping to make sure if there's any cases, they go and they use the special sanitization mist, Clorox 180, I believe it's called. And they hit all those areas for airborne virus killing. So that's something we keep our eye on when it's inventory as well.
I just want to say, as the largest employer in San Ysidro, what a marker mover SYSD has been, just with the leadership and the care and concern that's been taken. I mean, it really has moved the needle. I think when you look at stats, not just for county, but for state, especially being so close to the border, I mean, this is a huge deal. This is historical, in my opinion. It's monumental, and it's thanks to all of you and your just care and concern for humanity. Because if you're not passionate about humanity, you know, you all have become epidemiologists. So you honorary medical degrees here, you know, but it's so impressive. And I mean, it's very moving, but it's huge. And I know the community they feel they're blessed. And I want everyone to realize that, you know, these ESSER funds could have been used for a lot of things. And I know there's a lot of school districts that are finding loopholes to use it for other things, which I'm sure are needed. But these are being used honestly. These funds are being used honestly and directly for the prevention and the care of COVID. So I think it goes to say that, you know, the priority is and was and will continue to be safety. And I really appreciate all of the work that has gone into this. It's amazing.
Yeah, that goes back to it takes a village, and we have a very strong village, and that's why we are where we are, because of our village.
Before we go to that next slide, I'll just do a sincere thank you to Dr. Farkas for his leadership in COVID safety for our district. It truly has been notable. And there's not a week that goes by that we don't have a school staff member or families thanking our district for really being ahead of the game when it comes to all of the safety protocols for COVID, compared to, you know, kind of what's happening across the state and other school districts and schools. We'll also thank very much so Mr. Heath and his leadership in HR. It's very difficult to have a staffing shortage crisis. And there's usually this last week and this week, Mr. Heath is reporting to the office about 6 a.m. to try to see what we can do to find substitutes and be creative in covering our staffing shortages. So very, very grateful for that. And then with Miss Marilyn, our CBO, and also our Executive Director of Educational Services, Miss Gonzalez, they are the ones writing our ESSERS 1, 2, and 3 and ELO plans for emergency safety and staffing and even learning loss mitigation. So it's really been a team effort, and just a great thank you to everybody who's working together in a united, collaborative way to do our very best for our students that we serve and their families. We have two last slides that I want to quickly go through before we get to our one action item this evening. So this particular slide is our staffing shortage, what I'm calling a triage plan, wherein the shortage with staffing is such that we are now currently in a state of triage. So I do believe that's an appropriate word for us to use as a school district. So these are the four kind of overview steps that our district has put together to guide us through dealing with the staffing shortage. The first step is to ensure that all of our staff members, the minute they know they're going to be absent, to immediately report in ASAP, which is our employee absence online system, their absence, because the more lead time we have to find them the sub, the better it is for us. And then for us at that point to identify the number of substitutes that are needed for each day. There hasn't been a day that's gone by where we haven't been short subs. So not only are we short with high absence rates, but we simply do not have enough substitutes across certificated teachers, your administrative ranks, or your classified ranks to cover the number of absences that we're currently experiencing. So step two is to implement the staffing triage protocol. So let's say that we are short in a given morning 20 teacher subs. What do we do at that point? Well, at that point, then we're looking at our itinerant staff, like your sci-fi teacher team that has just been wonderful, your resource teachers, your intervention teachers, and we're saying, we're so sorry, we have to stop your program, your itinerant program, and we're going to ask you to deploy to a school because we have to have a certificated staff member in that classroom to open that class for students. And we're trying our very best to prioritize keeping schools open. So those three categories of teachers, we owe a deep debt of gratitude to the sci-fi, the resource, and the intervention teachers for deploying across the whole district to help the fact that we simply don't have enough teacher substitutes right now to cover the great number of absences. If we don't have an itinerant teacher to send because we've run out of them, then we've also deployed virtually every district office administrator out to the schools all of last week, all of this week, likely most of next week. It's been difficult because when they're out at the school serving as a substitute principal or a substitute teacher or just helping with supervision, maybe at lunch recess or the morning traffic or afternoon traffic, that means that the things that need to happen here at the district to run the district with all the state and federal reports and all of that, we're getting a big backlog at that point. So, trying to figure out how to shore up and deal with that issue as well. But we are prioritizing. The general ed classroom comes first. Keeping the schools open safely for students comes first. And that's what you're seeing in the actions that we have. If we don't have an administrator to deploy, then we are at that point asking that our teachers distribute students to other classrooms. We're using that as a very last resort. We do have that as a feature that we're able to do in our district. But again, we're trying first and foremost to put in a certificated person in the classroom first and foremost.
Dr. Potter, have we had to utilize or defer to that scenario that you just mentioned? Moving kids to other classes?
It's school by school and day by day. So yes, we have had this year because of the COVID situation, to move into that situation. Our one action item this evening is to be slightly more competitive with the highest paying school district for emergency teacher substitutes, because we've got one district that pays more per diem on an emergency teacher sub during COVID than we currently pay, even though we did raise that rate. So we're really looking at making sure that we are seen for folks who are subbing across multiple school districts, that they'd like to come and be here, make us their first priority. Step 3, we are expediting the return to work in accordance with the California Department of Public Health, which has provided at the beginning of January to allow for a shortened isolation or quarantine period. That period is a 5-day isolation or quarantine period. And at that 5-day period, if you test negative, you are able to return to school or to work. If not, then you keep testing each day thereafter until you do get a negative test and you're able to come back. The link to the decision tree is on here, and it's not too hard to find the decision tree if you go on the county's health department under COVID. The decision tree does seem to be changing on a week-to-week and month-to-month basis, so it is good to keep looking at that decision tree, and that is our guide for returning students to classrooms and to return our staff members to work. This final thing is employing. Last week, the governor had delivered a new emergency executive order to allow for schools to have staffing flexibilities. Those staffing flexibilities allow us to hire for a longer period of time retired individuals who are educators. It also allows us to extend a substitute period of time beyond the current period of time that they can sub for. And so all of those things are helping us to increase our substitute pool capacity. And that's really very important at this point in time. The more we can increase that capacity for subs, the better off that we're going to be in terms of mitigating the staffing concerns that are happening right now. Next slide. So I am grateful that Board Member Martinez pointed out that we do have this new website that was launched, I believe, yesterday, www.covidtests with a plural, TESTS.gov. And if you go on that, each address is able to order 4 free COVID tests from the federal government. And indeed, as Mr. Martinez pointed out, our board member, they will be delivered in a 7 to 12-day window of time. What does CDC say about using these tests? You want to guard them and save them until you really need them. So if you have a home test kit, if you have a positive case or a close contact in your house, save that kit so that when you hit day 5 or later and you need to do that secondary test to return to work or return to school, that's when you want to use that test kit. The second scenario, as Dr. Farkas pointed out, is what CDC is saying a symptom. And the primary symptoms that you want to look for are fever, sore throat, runny nose, loss of taste, or loss of smell. In addition to what's not on this slide, the federal government also, and Board Member Martinez, you may be able to help me with this, is allowing for each individual who has a private health insurance to individually purchase 8 home test kits per month and be reimbursed through your health insurance for up to $12 per test kit. So that just began, I believe, with orders that you might want to do online or in the store as of this Saturday or Sunday. Vaccine clinics. Dr. Farkas has been very successful in continuing to secure vaccine clinics here at our schools for our families and for our students. The next clinics that he has arranged appointments with are February 5th and March 12th at San Ysidro Middle School from 10 a.m. to 2 p.m. So we're grateful for that. And then if you want to go through the state's vaccine portal for an appointment for a vaccine, that website is www.myturn.ca.gov. Vaccine eligibility is now for everyone ages 5 and up. And thankfully, within a few weeks ago, about 2 weeks ago, the booster vaccine eligibility dropped down to ages 12 and up. I was able for my own child who's 15 to go on this www.myturn.ca.gov website. And I was able to get her a booster vaccine appointment within 1 week of the day that I went on to schedule her appointment. So there's certainly appointments available. And then if you're more comfortable coming to our vaccine clinic at Sims, that's an option as well. All right, next slide. So with this presentation, we just wanted to give all of our board members an update and overview of what the district is currently experiencing and to provide you with an opportunity to ask any questions or give us recommendations.
Thank you, Dr. Potter. I guess we'll go down the list. Board Member Martinez, do you have any questions?
No questions or recommendations. It was just good job in keeping up to date with everything. Great job, team.
Thank you. Board Member Gurmilan?
No, same as Mr. Martinez. Just thank you for the great presentation. Very thorough, very informative, and just want to again say that I appreciate all the work that's being done to keep our schools open and also keep everybody safe, most importantly.
Thank you. Board Clerk Irene Lopez?
Oh, yeah, I think it's great what everybody's been doing and putting in. And I noticed that some of the our technology staff was also being trained and given direction. And I appreciate that because I know it's hard for them, but I know that they know the schools and they know the system. And I think that's also helped. They're a group that hasn't been mentioned, but I saw that they were being told about it by Mr. Dr. Farkas and Mr. Acevedo. But I'm really leery, and I would like to know if maybe the district can provide some skates for Dr. Farkas. He's everywhere, and he's in and out. And maybe one of those, what do you call them?
Rollerblades?
Ghostbusters. I don't want him to get sick because he's always in and out. And I know last time when I saw him, he was tired. And I want him to be very cautious. And I think that we really need to be careful. And I know he's had the shots and he has the mask, but I thought, well, we should give him maybe something else other than that, a bubble or something that he could go around and come in and out. And because he's always out there. I see him, even when I don't even stop at the school, I see him there and I think, oh, he's here everywhere I go. So Mr. Farkas, I know that you and your staff and all your help and everybody else, it's really good to see that. And I think because our community, I think has always shown that we're the most hit in any way, even though other districts don't believe it, but they don't know our community. We have a lot of families that are very, 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 how would you say, humble, but at the same time, don't have the means sometimes. So what I hear about the testing and all that, I thought, oh, thank God that, they're thinking about people that can't speak our language or don't have transportation, but can be given the same opportunities as anybody else. So I'm really thankful for that. And I think that helps us understand that this is something we all need to help in, and we have done it. I know we have at San Ysidro. So it's a lot of love and a lot of blessings for all of you because it's not easy, I know. And it hurts me to see when I see a lot of people that have gone recently that I know because of this COVID and because of this Omicron also. But this is what makes us strong in this country, is that we need to realize that life is very important and we respect life by helping each other. So I really want to say thank to everyone who's been involved in all of this, because I know it's not easy. And I've sometimes hesitated in going out, but sometimes I want to see what's going on. If I don't get off, I do pass by, and I know they see my car and they look like saying, what is she doing here? But sometimes I don't get off and I don't, actually have that contact, but I'm watching, I'm seeing, and because I care for my community. It's very important. And I know that there's families there that are very, very grateful for what we've done. And it shows in their expressions. And when they call me and they tell me that, this is why they've remained here, because they feel this is their home, but at the same time, we're a family. And that's what we've shown them. So thank you. And let's continue and maybe be blessed with better health and peace and love.
Thank you, Ms. Lopez. Vice President Palasigue?
I have no other comments other than what I just stated earlier about how teamwork just moves the needle. And it really, really does mean a lot to the community. And we appreciate you so much more than you could understand. And I wish we could just send you all on Hawaiian vacations and things like that, but we can't. So we appreciate you very much.
Thank you. Again, I just want to reiterate, I want to thank Dr. Potter and the cabinet for leading the way, but all staff as well for letting us maintain our schools open and providing services to our children and their families. And then, yeah, seeing Dr. Farkas in action, Mr. Gurmilano and myself attended the test distribution. And when I drove past San Ysidro High School, there was a long line and the parking lot was still closed. And when I drove down to the middle school, they had already been going for at least a half an hour because they were ready on time and they decided why keep the people waiting. So everything went well. So thank you to all staff for their continued efforts and helping us keep our community safe. With that, we will move on to agenda item 7, general administration. We have one item, 7.1, revised substitute teacher salary schedule. It is to approve the revised substitute teacher salary schedule for the 21-22 school year effective January 20th until the end of the 21-22 school year.
So moved.
Thank you, Mr. Martinez. And it's been moved by Mr. Martinez, seconded by Ms. Palasigue. Dr. Potter, can you please call the roll?
Thank you, Mr. President. Calling for the roll call for agenda item number 7.1, beginning with Board Member Antonio Martinez.
Yes.
Board Member Humberto Gurmilan.
Aye.
Board Clerk Irene Lopez.
Yes.
Board Vice President Rosalia Palasigue.
Yes.
And Board President Rudy Lopez.
Aye.
Mr. President, the vote passes 5-0.
Thank you very much. Moving on to adjournment. Do I have a motion to adjourn at 5:53 p.m.?
I'll make the motion.
I heard Mr. Martinez, seconded by Ms. Lopez. Dr. Potter, please call the roll.
Thank you, Board President Lopez. Calling for the roll call to adjourn the meeting, agenda item number 8, beginning with Board Member Antonio Martinez.
Yes.
Board Member Humberto Gurmilan.
Aye.
Board Clerk Irene Lopez.
Yes.
Board Vice President Rosalia Palasigue.
Yes.
And Board President Rudy Lopez.
Aye.
Mr. President, the vote passes 5-0.
Thank you very much. And with that, we're adjourned. Thank you, everybody. See you next week. Good night.